Welcome to Lung Cancer Foundation of America's World Lung Cancer Day social media takeover. Right now, we are going to have one of the most important discussions of the day. We're talking with lung cancer patient advocates, Brandi Bryant and Dr. Sydney Barnett, who is also living with lung cancer, about how knowing their biomarker, yes, remember this word, biomarker, changed their lives.
It was an eye-opening conversation when we talked to these women about how important it is to ask, what is my biomarker? You know, it's especially important for Black Americans to ask this question because they, along with other minorities, may be less likely to be treated by lung cancer specialists, which are usually found in big city hospitals associated with universities. Did you know about asking about your biomarker can make a huge difference in your treatment? Let's take a listen to how much of a difference learning about their biomarkers made in Dr. Barnett's and Brandi's life. Dr. Barnett, you're a doctor and a lung cancer patient. That's a unique combination that we haven't really had before on the Hope with Answers podcast. I'd love to hear your story.
So I'm originally from Jamaica, and I've always been pretty active. I danced, swam, ran 5Ks. In 2016, when I was still living in Jamaica, I noticed that my exercise tolerance, I was just getting really short of breath with my runs. And I thought it was just because I was probably out of shape. But one night I woke up extremely short of breath and decided that I was going to get an x-ray when I went into work the following day. They did the x-ray, saw what they thought was walking pneumonia, treated me for that. But the symptoms kind of just didn't really go away. I started coughing. They treated me with steroids. And I was migrating to DC for my residency. So I said, I'll follow up with a doctor when I get there. Of course, internship is chaotic and working 80-hour weeks, I didn't get the chance to go right away. But I started wheezing and I was like, okay, I have a strong family history of asthma. With that abnormal x-ray, let me go to a lung doctor to kind of take a look at that. And they worked me up thinking I was having asthma, and we repeated a chest x-ray and I saw that the same abnormality I had the year before was still there. So I said to her, I was like, there's something in my chest, I need a CT. And we did the CT, and actually what we found was the mass in my chest was compressing my airway, and that was the reason I was wheezing. Yeah. And I can say after a whirlwind of tests, literally from the time I did the x-ray till the time that they told me it was stage 4 lung cancer was probably a month. And it was just shocking to me because my friends in Jamaica can tell you I was very obnoxious about smoking. I used to break cigarettes. I used to tell them, don't come anywhere near me. Why are you sucking on that cancer stick? So it was very ironic that I was diagnosed with lung cancer. Thankfully, I was found to have a biomarker, so I am ALK positive. I'm able to take targeted therapy that just pinpoints that mutation. And it's oral, so I was able to continue residency. I still work. I work as a hospitalist now. And that made such a world of difference for me in terms of my quality of life.
I think that's great. And thank you for sharing your story. I appreciate it. Brandi, you have a very unique story too, and biomarkers are part of your story.
Yes, biomarkers are a very important part of my story. My story is quite similar to Dr. Barnett's, actually. I was not as active as Dr. Barnett. However, I was a power walker, we should say. I was walking up to 40 miles per week, every week. And during those walks, I would actually be fine. Like, I wouldn't notice shortness of breath until I would get home and I'd be talking on the phone. And looking back, I realized I also had like a persistent cough that I had just kind of ignored because I'm a busy mom of 4, and the cough was more nagging, and it would be like at night, but it didn't interrupt my daily life, so I paid no attention to it. But it wasn't until I had the shortness of breath that I thought, oh my goodness, I can't, I'm like trying to talk to my mom, and and I couldn't catch my breath, and that frightened me enough to go ahead and call my doctor, prioritize myself, and call my doctor. And my doctor was really proactive. He said that Black women your age are at risk for sarcoidosis, so he wanted me to get an X-ray. I got the X-ray. Now and they thought that I had pneumonia, similar to your story. And mine took a little bit longer, but after referrals and a series of tests and CT scans, much the same. CT scan is like something was there. And the odd thing is, one of the doctors told me this, you have no risk factors. There's no way it's lung cancer. But after she saw the CT scan, her entire demeanor changed. And she just said, we need to get a biopsy. But she didn't give me any hope or ideas of what she was possibly looking for. But yeah, after the CT scan and biopsy, from the time I initially went to the doctor with my symptoms, it took about 3 months before I was diagnosed with stage 4 lung cancer as well. And just like Sydney, the biomarker testing happened without me even knowing it. I was really fortunate to be at a community hospital that immediately sent my sample off. I had no idea, because when you're diagnosed, you're in shock, right? But that was a critical part of my treatment without me even knowing it. And although I originally started with chemo and radiation, thanks to my biomarker testing, much like Sydney, I was able to take a targeted therapy when I was at stage 4. And I've had a great quality of life for the past 4 years. I've been able to watch my kids grow up, graduate. I mean, they're not all grown, but I'm just watching them complete these milestones. And that's really something I'm quite thankful for, that the research has made it to this point, because whenever I was diagnosed, the drug that I'm on had just been approved.
That's very hopeful, right? Your story is very hopeful. Now I want to go back a bit though. Dr. Barnett, some people may not know what a biomarker is or why it's important to find out about one. Can you tell us a little bit more about that?
So each cancer is pretty unique. And what you can find is you can find specific traits that can tell you how a cancer works. So for instance, Brandi and I have ALK, but there are other biomarkers such as EGFR, KRAS, that they are drivers of the cancer. But if you're able to find that driver, that mutation, that biomarker, then you can take targeted therapy, which is for us a pill, and we take that twice a day, and it tends to be a better quality of life versus doing the traditional therapies such as chemotherapy or even immunotherapy. And I think that that's one of the main things that I do tell any patient who's diagnosed with lung cancer, is that they should get biomarker testing, just to find out what are the different specific things about your cancer that could potentially help with your treatment. It's very important.
It is important. And I know that it's one of the messages that you give. What other messages do you have for Black Americans specifically?
So there are many issues that happen with Black Americans. I mean, lung cancer is a leading cause of death for a lot of people, but especially Black Americans. And unfortunately, one of the aspects of it is the disparity in terms of treatments that they get. So I do think that, I would want them to be educated to know that, don't discount a cough, don't discount shortness of breath, don't discount wheezing and just think, it's nothing. Go to your doctors, tell them I've been having these symptoms, they're not going away, can we get imaged? And, if they're doing this workup, unfortunately for potentially lung cancer, demand that they do biomarker testing so that, that could ultimately be a change of outcome in terms of your survival.
Is it as simple as asking, what is my biomarker?
Yes, it is very simple to ask that. A lot of the times, unfortunately, in community centers especially, people are not being sent for biomarker testing. So having the public being educated about it sometimes will help to nudge these community doctors to get the biomarker test for their patients, especially if the knowledge is out there. A lot of people know about immunotherapy because they have seen Keytruda ads, and they know to ask their doctors, oh, so what about immunotherapy? Biomarkers should be the same. We need to say, hey, you're telling me I have lung cancer. Well, I've heard about biomarkers. So do I have a biomarker? And if they haven't tested you, can I get tested for a biomarker? Because in my experience, I would not have been able to complete residency had I had to do chemotherapy and all of that stuff. I would have been too tired. I mean, there's no way I could have done chemotherapy with 80-hour work weeks. But I was able to complete my residency with no time off because all I had to do was take a targeted therapy. And I've been taking that same targeted therapy for 5 years now, and I've had a wonderful response. So, most important thing, what is my biomarker?
Absolutely, that's it. And would it have made a difference for you, Brandi, had you known your biomarker earlier? Would it have made a better quality of life? Or did you said that they tested and you didn't even know that they tested. Did they tell you what your biomarker was right away?
No. And I wish I would have known whenever I was first diagnosed how important that was and how much I actually could have fought to not have to do chemo and radiation for those 6 weeks because I ended up on the targeted therapy anyway. But it would have made a huge difference in me not having to be so sick. I was sick for quite a while due to that initial treatment. But the biomarker testing, you have to ask. Like if you're diagnosed really with any type of cancer, ask what your tumor is being tested for. And they will figure it out. Like you don't have to know the exact name of the test. Just say, what are you testing my tumor for? And then you can take the time to go and look it up later. But that biomarker, the targeted therapy that I'm on right now completely changed the game for me. And I'm so thankful for that.
Explain to me what targeted therapy looks like for you.
So for me, we're both ALK positive, but I'm on a different drug than Dr. Bryant. But for me, I take 4 pills in the morning with food and 4 pills at night. So it's 12 hours spaced. And really, I wanted to say the side effects are minimal. Like as long as I've been on it, I don't even notice them anymore. You're a little more tired, but you just keep moving. And that, I'm fighting stage 4 cancer. And you would have no idea.
That's right.
So
Exactly.
I'm very thankful for the research that got us to this point, and I'm really excited about more research to come.
And research has come so far that now we have these treatments that you're talking about, and we know that there are many clinical trials out there, so we're on the cusp of moving even further. I'm wondering, Brandi, what does research mean to you?
Research to me is hope, like in big capital letters. Research is hope. Research has me sitting here today. Research will hopefully have me sitting here in hashtag give me 20 years post-diagnosis. I am confident that the things that these researchers are working on, especially the ones that are funded by Lung Cancer Foundation of America, I'm excited. And I'm excited that I'll get to see all of my kids graduate from high school and college. And I don't care if they get married and have kids, but I just want to be there. I may later. I just want to be there. Like my mom has been able to be there for me. Yeah. So that's what research means to me, is like, I'm going to be here.
I'm interested in both of you answering this, and we'll start with you, Dr. Bryant. Were you surprised at the lack of federal funding for lung cancer?
I was surprised at a lot of things. I mean, as you said, I am, doctor, but even I didn't really realize, I was always told, lung cancer equals smoking. And that was probably one of the reasons why I was so obnoxious about it. But, there's like a little line in the medical school book saying that, there are people who get lung cancer without smoking histories, and that line is not highlighted enough. So when I was diagnosed with lung cancer, it completely caught me off guard. I remember even saying to my doctor, like, I don't smoke. How is this possible? And I think, as Brandi was saying, it has a lot to do with this stigma, all right? And I mean, I do think, yes, I did contribute to it before, but I was ignorant. And that is one of the things I do tell people all the time, this stigma needs to go. Smoking, yes, 70 or 80% of people who do get lung cancer do smoke, but so what? Yes. So what if they smoke? Does that mean that we should have less empathy for them if they get cancer? Does it mean that, we're thinking that they deserve cancer? As smoking is a risk factor for so many different things. It's a risk factor for heart disease, it's a risk factor for breast cancer, it's a risk factor for head and neck cancers, it's a risk factor for a lot of different diseases.
And it's addictive.
Exactly. It's an addiction, right? So I may smoke and it does nothing for me. Someone else may smoke and they may get a nice buzz, right? So it's really not fair that you want to, my mom used this word a lot, demonize someone for a habit that they probably did when they were young and dumb, right? Or even a habit that they want to kick, but they can't, all right? And I think that that's the thing, is that because they feel guilty themselves, they don't ask more for help, or to ask their doctor, I've been smoking and, am I at risk for lung cancer? What can we do to prevent my risk? Don't just tell me, stop smoking. It's easier said than done.
Absolutely. Absolutely. And Brandi, what about you? Were you surprised at the lack of funding for lung cancer? Federal funding?
I was completely blown away that lung cancer is the #1 killer and we get such little money. And I remember thinking that, oh my gosh, if we had even half of what some of these other cancers are funded, how far would our research have already gone? Like, I remember when I first heard about the disparities in funding, and I was like, wow, I'm doing so well on this treatment that research helped me get to. Imagine how many lives we could save, like how many people we wouldn't lose if we had more money to fund all these brilliant ideas that these researchers have.
Yeah, what was the figure that I heard? 60% of proposals
that are marked excellent.
To the CDMRP, which researches lung cancer from the DoD, are not funded because of
Defense.
Right, sorry, Department of Defense. But they're not funded because they don't have the funds.
They don't have the
right?
funds. So it's great ideas.
Right.
That the reviewers are saying this would be great research that we're having to say no to.
Right.
These conversations really hit you. It really hit me when Brandi said that knowing her biomarker was a game changer for her, and how thankful she was.
And, Diane, when she said, I just want to be there, like my mom has always been able to be there for me. And that's what research means to me, is like, I'm going to be here. And I would love for anyone who knows their biomarker to comment on what that means to them.
I would too. I think that'd be great. And, you can hear more of this conversation on our Hope with Answers podcast. It's really worth listening to. And if you'd like to join the conversation, join Lung Cancer Foundation of America on Facebook, Twitter, Instagram, and TikTok throughout the day. And search the hashtags Living with Lung Cancer and LCFA Research.
And if you need to know more about living with lung cancer, LCFA has so many great resources available. The first place I would point you is their website. That's lcfamerica.org. There you're going to find accurate and hopeful information, including the podcast, Diane, you just mentioned, videos, and so much more. And if you'd like to support LCFA and its mission to support and fund groundbreaking lung cancer research, all you have to do is text LCFA to 41444 to make a donation.